Julie O'Malley, Nurse Manager of Pediatrics and Adult Medical Surgical Unit at Silver Cross Hospital. Joining me today is Dr. Asta Astrauskas. She is a Lurie Children's Hospital pediatrician and is our Chief of Pediatrics here at Silver Cross. And we are talking about RSV, or respiratory syncytial virus. We all have heard stories about how prevalent this RSV season is. So we thought we would talk about what we're seeing here at Silver Cross and how you at home might be able to take some steps to avoid getting sick. Dr. Astrauskas, can you tell me exactly what RSV is and what are the symptoms?
So RSV stands for respiratory syncytial virus. So if we look at it, it's a respiratory virus. Our respiratory tract starts from the nose, goes all the way down in the bottom of our lungs. When disease progresses into the lower part of our respiratory tract, which would be lungs, that presentation becomes a little more severe. They usually have wheezing, deep cough, lots of secretion formation. They also have very abnormal breathing.
That's great information to know. Now, when are the children most contagious?
Sometimes they become contagious before they even develop symptoms, about a day or two before, and they're contagious for their entire illness. Usually we say until the fever resolves, 24 hours after. But interesting thing of RSV virus, it does not peak until about 5th to 6th day.
And what ways do you think that we could prevent the illness for parents at home? What can they be doing?
Okay, so if you know that your child has RSV, isolating for a week, that means not sending to school or to daycare, would be preferred. At home, what you can do, obviously hand washing, soap and water, these are two magic things, and masking if it's possible. On hard surfaces, RSV virus can survive up to 24 hours and longer. These need to be sanitized for sure.
Are there any vaccines that we could be doing for our children?
So far we don't have an RSV vaccine, but our scientists are working very hard to develop one, and most likely year 2023 will have a vaccine. But we have a vaccine for influenza and COVID. Children can get 6 months and older can get both vaccines.
So with RSV and influenza, we see a lot of children with a lot of secretions. Is there anything they can do at home to help alleviate that at all?
Absolutely. What happens in the little babies that they produce so many secretions that they plug their airways. And the younger they are, let's say 2 months and younger, they obligate nasal breathers. So if they plug their nose, they can't breathe. And they start exhibiting all these very worrisome symptoms. So suctioning their nose, getting the secretions thinned out, and then suctioning them out. That would be a key, keeping the hygiene and the cleanness of the airway. I have a question for you. How are we prepared at Silver Cross to deal with this surge?
We have been preparing for this for the last few months, so we really have upped our training for respiratory care for our nurses on the inpatient unit, as well as working with the ED and our respiratory therapists, who are so valuable in helping us care for these kids who need a higher level of respiratory care, which most of them do. So we have tripled our supplies on the unit. We even have some emergency airway equipment of all sizes on the unit, ready to go. Our children are getting the best care they possibly can. We have Lurie's doctors here 24/7 as yourself, and we always are working together as an amazing team, so we are ready to go.
We are. Thank you, Julie.
Thank you, Doctor. This has been valuable information, and I hope that all of you that are tuning in, this helps a little bit alleviate any concerns you have and have educated you a little bit today.